Welcome to the online learning modules for exercise prescription guidelines. This is the third of 4 modules that you will be watching. We ask that you do not look up any other materials in regards to the information that you're about to see. Feel free to take notes throughout if you would like. For more information on the topics covered in this module, please visit the host website of exercise-prescription.web.unc.edu. Thank you, and I hope you enjoy this module. This third module is on the American College of Sports Medicine's guidelines for flexibility training. It is important to note that these modules are focused on the guidelines for sedentary, healthy individuals. All of the guidelines are based on the FIT-VP principle for exercise prescription. The objectives for this module are to learn the FIT-VP principle in relation to the ACSM's flexibility training guidelines. It is expected that students will be able to know the frequency, intensity, time, type, volume, and progression of recommended flexibility training after watching this module. First, let's go over what flexibility is. Flexibility is defined as the ability to move a joint through a full range of motion with ease. Now let's go on to the importance of flexibility training. The goal of flexibility training is to improve range of motion in the major muscle tendon groups, improve postural stability, correct muscle imbalances, improve balance control, and to make everyday movements easier. Range of motion around a joint is improved immediately post-stretching, and chronic improvements are shown to occur 3 to 4 weeks after beginning a regular stretching routine of stretching 2 to 3 days per week. It should be noted that flexibility is joint specific, which means that just because a person has good range of motion in one joint, for example their hips, does not mean that they also have good range of motion in another joint, or for example their shoulders. The next question you probably have is, when should a person perform flexibility exercises? Flexibility training should be performed when the muscle temperature is increased through warm-up exercises. However, stretching exercises have been shown to immediately decrease muscle strength and power for a short duration of time after completion. Therefore, flexibility exercises should be performed after exercises in sports where strength and power are strongly correlated with performance. Also, the type of stretching and when certain stretches are utilized during a training session is important to understand and something we will go into more detail about in this module. Now let's go on to explain one of the points from the last slide about correcting muscle imbalances to improve flexibility. This information on muscle imbalances is from the National Academy of Sports Medicine's textbook, which is another organization that provides exercise certifications. Muscle imbalances are caused by altered reciprocal inhibition, synergistic dominance, arthrokinetic dysfunction, and decreased neuromuscular control. And we're going to go into more detail about all of these in a second. Before we go into detail about the information on this slide, let's first talk about agonists, antagonists, and synergist muscles. When you have muscles performing an action, such as flexion and extension, you have an agonist muscle as well as an antagonist and synergist muscle, or muscles. The agonist is the primary muscle involved in the movement performed. The antagonist is the opposing muscle to the one performing the action, which must relax as much as possible to let the agonist contract. And finally, the synergist is the muscle or muscles that assist the agonist in its action. Now let's talk about reciprocal inhibition. Reciprocal inhibition naturally allows movement to occur. It is the simultaneous relaxation of one muscle and the contraction of its antagonist. So for example, during a bicep curl, the triceps are going to relax to allow the bicep muscle to contract. Now, let's move on to altered reciprocal inhibition. This is caused by a tight agonist muscle decreasing the neural drive to its antagonist. So, for example, tight hip flexor muscles decrease the neural drive to the gluteus maximus. In this example, the hip flexors become overactive in order to make up for the decrease in neural drive to the gluteus maximus, which, if not corrected, can lead to potential injury. Muscle imbalances can also be caused by synergistic dominance and arthrokinetic dysfunction. Synergistic dominance is the neuromuscular phenomenon that occurs when inappropriate muscles take over the function of weak or inhibited prime movers. An example of synergistic dominance can be seen with the glutes and the hamstrings. If the glutes are not activated during a movement, then the hamstrings, which are the synergist muscle for hip extension, have to work harder to produce the same force without the use of the glutes. The result of synergistic dominance is faulty movement patterns that will eventually lead to injury if not fixed. Now let's move on to arthrokinetic dysfunction. This might not be a term that you've heard before, but arthrokinematics refers to the motion of the joints. So therefore, arthrokinetic dysfunction refers to the altered forces at the joint that result in abnormal muscular activity and impaired neuromuscular communication at the joint. Or, in other words, it is altered joint motion. If not fixed, this can cause poor movement patterns, which can lead to injury. Overall, these last 4 points all cause muscle imbalances, which can be fixed with regular flexibility training. This is a figure taken from the National Academy of Sports Medicine's book, which summarizes what we were just talking about with muscular imbalances. You can see here that altered reciprocal inhibition, synergistic dominance, and arthrokinetic dysfunction all lead to altered neuromuscular control. This can result in tissue fatigue, which results in cumulative injuries, which cycles back to muscular imbalances. Now let's move on to the FIT-VP principle, and first, the recommendations for frequency of flexibility training. Remember that the frequency of physical activity is the number of days per week dedicated to performing physical activity. The ACSM recommends that sedentary, healthy adults perform 2 to 3 days per week of flexibility training, with daily stretching being most effective. Now let's move on to the second letter of the FIT-VP principle, or intensity. The ACSM recommends that a person stretch to the point of feeling tightness or discomfort, but not to pain. Let's now move on to the third letter of the FIT-VP principle, or time. Exercise time is the amount of time physical activity is performed. It is also called duration. In this module, exercise time refers to how long each stretch should be held. The ACSM recommends that sedentary healthy adults hold each stretch for 10 to 30 seconds. Let's now move on to the fourth letter of the FIT-VP principle, or type. The ACSM recommends that sedentary healthy adults perform stretches that target the major muscle tendon units of the shoulder girdle, chest, neck, trunk, lower back, hips, posterior and anterior legs, and ankles. Now let's continue on with the recommendation. The ACSM recommends many different kinds of stretching, including ballistic, dynamic, static, active static, passive static, and proprioceptive neuromuscular facilitation, or PNF, We'll go into more detail in the following slides. Let's first start with ballistic stretching. Ballistic stretching is the use of momentum or bouncing of a body segment to produce a stretch. This type of stretching is very controversial because it can cause injury to the connective tissue if the stretch is performed too quickly or if a joint's range of motion is overly exceeded. This type of stretching might also seem counterintuitive. During ballistic stretching, a muscle is lengthened at a quick rate. Inside the belly of the muscle is a sensory receptor called the muscle spindle. The muscle spindle detects changes in length and the rate of changes in length of a muscle. The muscle spindle protects the muscle from overstretching and causing muscle fiber damage by sending an impulse to the spinal cord for the muscle to contract. This is called the stretch reflex. Therefore, ballistic stretching repeatedly excites the muscle spindle, resulting in stretch reflexes that cause the muscle to repeatedly contract. However, the ACSM advises that ballistic stretching may have a place in warm-ups for workouts that involve movements that are similar to ballistic movements performed. The ACSM cites an article on basketball players in the Journal of Sports Conditioning and Research in support of ballistic stretching. The researchers found that vertical jump height significantly increased 20 minutes post-basketball play after performing ballistic stretches prior to playing. The article can be found at the end in the references. Another type of stretching is dynamic stretching. Dynamic stretching is a gradual transition from one body position to another, and a progressive increase in reach and range of motion as the movement is repeated several times. Dynamic stretching is also performing a movement through an extended range of motion without exceeding a person's static passive ability. Dynamic stretching is different from ballistic stretching because it is a controlled, smooth, and deliberate movement. You can see on the right of your screen some examples of dynamic stretches. Another type of stretching is static stretching. Static stretching is slowly stretching a muscle tendon group and holding the position for a period of 10 to 30 seconds. Static stretching can be active or passive. The point of static stretching is to gradually lengthen a muscle through performing and holding a stretch for a long enough period of time, say 10 to 30 seconds, for the Golgi tendon organ to override the muscle spindle in the same muscle. This is called autogenic inhibition. We'll go into a little bit more detail about that later. And you can see to the right of your screen some examples of static stretches. Now let's look at active versus passive static stretching. Active static stretching is holding the stretched position using the strength of the agonist muscle. This is common in many forms of yoga and is different from passive stretching because it is not using any outside assistance for the stretch, such as bands, another person, or a stretching device. Now, passive static stretching is different than active static stretching because during passive static stretching, a person is assuming a position while holding a limb or other part of the body with or without the assistance of a partner or device. So in other words, they're using outside devices to help them with the stretch, such as bands or another person or a stretching device, body weight, leverage, or gravity. So let's now look at the table you can see at the right of your screen, and specifically on the left of that table. At the top, you see a person's doing a passive active stretch, and they're using that little platform to help them stretch and gravity. So as they stretch their calf muscle by letting the heel fall down, they're letting gravity and the device help them with the stretch. Versus at the bottom, on the bottom left of that table, you see the person is performing a static active calf stretch by just pulling their toes towards their face without actually using any other device to help them with the stretch. Let's now look at proprioceptive neuromuscular facilitation, which is commonly called PNF stretching. During PNF stretching, a person holds a light to moderate contraction of around 20 to 75% of their maximum voluntary contraction for 3 to 6 seconds. This is followed by an assisted stretch for 10 to 30 seconds and should be repeated 4 to 5 times. There are 3 different ways to do PNF stretching. In this module, we're going to focus on the hold relax technique, but the 2 other techniques are the contract relax technique and the hold relax opposing muscle contract technique. So let's now look at how PNF stretching would be completed for the hamstrings using a partner to assist in the stretch. During the hold relax technique, the person first starts by lying on the floor in a supine position with one leg extended on the floor and the other in the air as close to a right angle as possible. The partner places a hand behind the heel and a hand right above the knee of the stretching leg to keep the leg straight. The partner will then press the heel towards the person's chest until they feel a mild stretch. This stretch is held for around 10 seconds and is called the pre-stretch. The person stretching will then perform an isometric contraction of the hamstrings, or in other words, try to push against the partner's hand that is holding up their leg without actually moving the leg. This will be held for 3 to 6 seconds and then the person relaxes. The partner will then press the person's leg closer to their chest until they feel a mild discomfort again. This will be held for 10 to 30 seconds. This technique works because it causes autogenic inhibition of the hamstrings and relies on the firing of the Golgi tendon organ to cause reflexive muscle relaxation. Here's a nice summary of the different types of stretches that we just talked about, and it gives you all the definitions too. Let's now move on to the next letter of the FIT VP principle, or the volume of flexibility training. The ACSM recommends that healthy sedentary adults perform 60 seconds of total stretching time for each stretch by performing each stretch 2 to 4 times. So, for example, a person could perform each stretch for 30 seconds and then do each of these stretches twice for a total of 60 seconds of total stretching time. Or they could perform each stretch 3 times, 20 seconds each. Both of those would equal 60 seconds of stretching time for each stretch. Now on to the last letter of the FIT VP principle, or the progression of flexibility training. The ACSM does not have any set recommendations for the progression of flexibility training. Here's a summary slide of the ACSM's recommendations for flexibility training for healthy sedentary adults based off of the FIT VP principle. Thank you for watching this third module on the ACSM's guidelines for flexibility training.